Hi Joan, Alex, Shae, and I are doing the varicella immunization. We will be talking about what's important and why your child should get this vaccine. Varicella. Varicella is a virus that spreads by the respiratory tract and by contact. This is a highly contagious virus that usually occurs to children before adolescence. It is commonly known as the chickenpox virus. The types of immunity, so there's innate, adaptive, and passive, and active. Innate is most natural immunity and resistance to harm. Adaptive develops through the lifespan of an individual, example, going through the mother during birth. Passive is exposure to the body to a specific antigen and can be exposed for a certain amount of time and then become immune to the disease. Lastly, active is when an individual is administered and immunized against a certain microorganism, agent, or pathogen. So, a Canada fact. 1999, varicella chickenpox vaccine became available in Canada. Before the vaccine, which was 1999, around 350,000 varicella cases and 1,500 to 2,000 related hospitalizations occurred every year in Canada. How do we storage these vaccines? So this would be important for practical nurses to know as well. Vaccines are stored in a refrigerator or freezer from the time it is created to the time it is administered. This is 22 to 8 degrees Celsius, depending on the type of vaccine, of course. When vaccines are not stored properly, they can be modified by the warmer temperatures and become fatal to an individual if instilled. Signs and symptoms. So signs and symptoms that we'll be looking for when administering this vaccine is a fever, lack of appetite, headache, discomfort, fatigue, rash, pink reddish-like bumps, small blisters, and severe itchiness. These bumps, also known as chickenpox, can spread all over the body. They can become very painful and tender. Scratching can cause scarring on the skin and can also infect the blisters. If the skin becomes very hot and tender, make sure to seek medical attention right away due to a possible infection of the skin. We also have on our fact sheet here the telecare number and dial 811 from any phone. The causative agent of varicella is a shingle-like virus that attacks the skin and causes small or medium-sized red bumps with severe to mild itchiness.
Hi Joan, I'm going to continue on with presenting our fact sheet on varicella. So how do vaccines work? Vaccines are created to be used in fighting off pathogens that try to invade our bodies. They are a simple dosage of the actual infectious agent. However, the agent is a poor agent that is unable to stay alive and duplicate in the body, so it's too weak to actually cause an infection. When the vaccine is administered, the body then creates a defensive system against the infectious agent. After receiving the vaccine, the body will have an active immunity against the varicella. Now onto the back, we have isolation. So for varicella, we need to follow standard airborne and contact precautions. Standard is wearing gloves, gown, and mask, and of course washing your hands. Airborne is hand washing, gloves, gown, N95 mask, and eye protection. And contact is gloves and a gown. A common myth about vaccinations that is not true is my child doesn't need vaccination because no one gets these diseases anymore. Although they're not as common as they used to be, they do still exist and they do need to be vaccinated against. How long is varicella contagious? It's contagious from 10 to 21 days after the individual has been exposed to the virus. When the blisters are visible on the skin, they can be highly contagious by contact. And we have some nursing interventions for varicella. They include trimming the fingernails to prevent scratching, calamine lotion to reduce itching, and the isolation precautions to prevent transmission. And we also have which vaccine is recommended. Of course, it's the varicella vaccine, which is also known as chickenpox. It does not typically cause the chickenpox to appear, but it does stimulate a response from the body's immune system. The vaccine will protect the person who has received it against varicella.
Just kidding. Hi, Joan. So the varicella vaccine is given as an injection into the thigh or upper arm. Common adverse reactions, so soreness, redness, swelling, mild fever. A rash may occur around this area where the vaccine was given within 5 to 26 days after immunization. The varicella, chickenpox, like blisters, occur. And then interventions, cold bath, ice packs, calamine lotion, and warm bath. The vaccine is provided to children as a series of 2 doses. The first dose is given at 12 months, second at 18 months, and the vaccine is given at the same time as other routine childhood immunizations. The second booster dose of vaccine can be given at any time after 28 days. Who can get the vaccine and who can't? First dose at 12 months, second at 18. Other people include living with younger children, healthcare workers, adults who may be exposed to varicella, immigrants and refugees from tropical climates, anyone undergoing chronic salicylic acid treatment, people with cystic fibrosis, and then who should not receive the vaccine. Allergic reaction to the vaccine in the past, is allergic to any of the ingredients of the vaccine, is pregnant or planning to become pregnant. And then for additional information, contact healthcare provider, local public health office, or telecare 811. And then there's more resources in the bottom: Government of New Brunswick, Canadian Coalition for Immunization, and Public Health Agency of Canada.
Happy
Hi,
Thanksgiving, Joan!
Happy
Happy Turkey Day!
Enjoy your
Hope you don't
turkey.
get varicella.